Acknowledge orders. Alright. Knock, knock, knock. Hi, my name is Jackie. I'm gonna be your student nurse for today. We're gonna be doing a physical exam, okay? What I'm gonna do first, I'm gonna wash my hands, okay? Wash hands. Alright. And pull curtain for privacy. Alright. Let's start with first, can you tell me your name and date of birth?
Kelly Vernon, 3/27/81.
Alright, perfect. And we're gonna start a physical exam, so it's gonna be all the way from the top to the bottom. Some questions involved. So this will be about 30 minutes. Is that okay? Alright. And then, what else? Okay, so let's first start off with some questions. Do you have any cultural or spiritual preferences that you would like for me to consider?
No.
Okay. And then do you need to go to the restroom?
No.
Okay. Do you have any drug allergies?
No.
Okay. All right. So let's start with the top. Okay. Just to start off, do you know where you're at?
Yes, Shermana Community College.
Okay, perfect. And do you know what date today is?
The 16th.
Okay. What month?
April.
Perfect. Do you know the year?
2024.
Okay. And then, person, place, time. And do you know why you're here?
For a physical exam.
Okay, perfect. So your mini mental and Glasgow Coma scale is deferred due to A&O times 4. All right. And so let's start with some more questions. Okay. Have you ever had any head injuries?
No.
Okay. Have you had any strokes or head problems, like anything like that?
No.
No. Okay. And then do you have headaches?
No.
Okay. Do you have any family history of any neurological problems?
No.
Okay. All right. So let's start with asking you some more questions, and then we're going to start assessing. Is that okay with you if I touch you?
Yes.
Okay. So let's begin with musculoskeletal. So what I want to do is I want to put my hand here, and then what you're going to do is you're going to push against it. Okay. Perfect. And same thing over here. Perfect. And then what I want you to do now is to you already pushed against it. Okay.
Mm-hmm.
And then go to the side. Did you do that one? Perfect. Do like that. Perfect. All right. And then same thing with the shoulders. Push against. Perfect. All right. And then what I want you to do is, can you put your fingers like this? Hold around my fingers, and then what I'm going to do, I'm going to pull back, and you try to pull me back. Okay. Perfect. All right. Perfect. So strength of your upper extremities, range of motions, everything's normal up here, upper extremities. We're gonna move down, okay? All right, and your muscle strength of your grip is 4 plus.
Mm-hmm.
And then what I'm gonna do is I'm gonna test your legs, okay? So push against me. All right, push against me, all right. Push in, push out. All right, push up, push down. Perfect, very strong. Okay, muscle stone strength is 4 plus. And then what I want you to do, if you could, do you want to get your shoes?
No,
okay.
sure.
All right, so what I want you to do is to stand up, just kind of copy me, and we can assess that. All right, so first start like this. The slow windmill forward, perfect. Next one. All right, and then you go ahead with your leg. Perfect, cross. And then cross. All right, perfect. And then rotate it. Rotate it. Like crap too. All right, perfect. All right, range of motion of the lower extremities are all normal. And then since we're have you up here, if you can go ahead and bend over. All right. I'm going to check for scoliosis, kyphosis, or lordosis. All right, none of that. no scoliosis, no kyphosis, no lordosis. And then if you could walk to over there and then walk back. All right, perfect. Normal gait and swing. All right, you can go ahead and hop back up. You can help. Okay. All right, perfect. So now what we're gonna do is we're gonna assess for cranial nerves, okay? So I'm just gonna direct you a little bit. So the first thing I wanna do is, if you can close your eyes for me, I'm gonna put something in front of you and you tell me if you smell it or what it is, okay? All right.
You wave it.
You smell it?
Yes.
Okay. And then, all right, so cranial nerve 1 olfactory is intact. And cranial nerve 2, Snellen-Char, is deferred, that's optic. And then cranial nerve 3, 4, and 6, I'm gonna use my pen for. All right. What I want you to do is I just want you to follow this pen, okay? And then I'll always be moving it and then going back to the middle, okay? All right. Right there. Right, cranials 3, 4, and 6 intact, and that is the trochlear motor. I have abducens, trochlear motor. Sorry, let's start over. So I have 3, which is cranial nerve 3, oculomotor, and then 4 is the trochlear motor, and then trochlear, sorry, and then 6. Cranial nerve 6 is abducens, all intact. All right, and then what I want you to do after that is I'm gonna place something on your face. I want you to close your eyes and you tell me if you feel it and where it's at and if it's sharp or smooth, okay?
Smooth.
And where is it?
Forehead.
All right.
Sharp.
Yeah.
Smooth.
All right, where is it?
Cheek.
All
Smooth. Chin.
right. Okay. Cranial nerve 5 is intact, trigeminal, and I want you to chew real quick. This is part of cranial nerve 5, trigeminal. All right, perfect. And then okay, so cranial nerve 7. I just want you to copy me, okay? I'm gonna do some facial expressions. Okay, so. All right, so cranial nerve number 7, facial expressions intact. Let's see, what else? And then cranial nerve number 8. All right, I'm gonna go behind you, and what I want you to do is close one ear, and that's the, I'm gonna say something, I'm gonna whisper, and then you tell me what I'm saying, okay?
Green apple.
All right, cover the other ear.
Blue raspberry.
All right, perfect. Cranial nerve 8, vestibular cochlear intact, which is also acoustic. All right, and then we're cranial 9, which is glossopharyngeal gag reflex, is deferred. Cranial nerve 10, sorry, I don't know why I said 7. All right, go ahead and swallow for me. Perfect. So cranial nerve number 10, which is swallow. Sorry, cranial nerve 10 is before I forget this one. Vagus nerve is intact, and then we already did the shoulders, but if you want to do it again, all right, perfect. And that is cranial nerve 11, which is the spinal accessory is intact, and then the cranial nerve 12 is the, go ahead and stick out your tongue, and side to side, perfect. And that is cranial nerve, sorry, where's that at?
12.
12. Glossopharyngeal. I thought that was 9. Which one am I confusing?
9 is hypoglossal.
Oh, okay, sorry.
You're good. You're good.
Glossopharyngeal is number 12, and that one's intact. Okay. All right, so everything was great with your cranial nerves exam. All right, so then we're gonna start off with the skin, right?
You
Head. Let's do
Hint.
a hint. Hint, skin. Let's go that way. All right, so first off, let's start off with do you have any lumps, bumps, or anything on your head that you know that you're being seen for?
I do. I have one. I do not have 9. It's for your benefit.
I know, but it's
I have
funny.
none. Tomorrow will be none.
Okay. All right. So I'm gonna start off with checking your scalp. Okay. No hair loss or anything.
No.
All right. No lumps, bumps, masks noted on present on the scalp. No infestations. All right. So let's go ahead and check your ears. All right. And tympanic membrane is pearly gray. Cone of light is visible. No earwax. Do you have any problems hearing?
No.
Okay. Do you have any the next one. All right. Pearly gray cone of shield visible. No earwax noted. All right. No injuries to your ear.
No.
Okay. All right. So let's go ahead into eyes. Okay. So So I have an ophthalmoscope, and what I'm gonna do, if you can just focus your vision that way, I'm gonna move side to side, but there will be a light shining on you, okay? All right, go ahead. Okay, perfect. And the sunset is visible, and optic fundus. Optic fundus is like a sunset color. All right. Same thing. Optic fundus is like a sunset color. Perfect. All right. And now I'm going to do with the light. Okay. So first I'm going to see if pupils are reactive. Perfect. Perfect. Bilateral pupils are reactive, no nystagmustosis noted. All right, and then one more thing is I'm gonna do is, after I check like this, I want to check for the sclera. So go ahead and go like this and go up, all right, and pull like this and then go down. All right, sclera is white, conjunctiva pink and moist. All right, no dryness, which is great, because that's a problem. All right, and then go ahead into the nose. So what I'm gonna do is if, do you have any problems with any congestion?
No.
Okay, any nose injuries or anything like that?
No.
Okay, and if, any problems breathing through your nose?
No.
Okay, I'm gonna go ahead and go like this. All right, septum, no deviated septum. Nostrils are symmetrical. Nasal nose is symmetrical. All right, and then what else? So its lips are moist and pink. Okay, go ahead and open your mouth. All right, perfect. And gums look good. Teeth look good. No cavities. Do you brush your teeth twice a day? Do you floss?
Yes.
Okay, perfect. All right, do you want to stick out your tongue for me real quick? All right, you was president and midline. All right, and no abnormalities. Any problems with chewing food?
No.
Okay. And then go ahead and next thing I wanna do is wanna check your sinuses. And so what I'm gonna do is I'm gonna touch you, and you just tell me if you feel any pain or tenderness. Do you have any problems with congestion anywhere?
No.
Okay. So I'm checking the frontal sinus, ethmoid, and the maxillary. No inflammation, no congestion noted. Alright, and then I'm gonna go down to mandibular while I'm here. Submandibular and submental. No swelling noted. Alright, and then I'm gonna touch your ears, around your ears, okay? So, preauricular, postauricular, and then cervical, and then subclavicular. Everything looks great and feels great. No swelling noted, no congestion noted. Alright, the skin is looking good. No redness, no swelling, it's normal temperature. What else? Let's see. Let's start with, okay, so let's go ahead and do the pulses. Okay, so we're gonna do the temporal. Okay, right there. Alright.
I can do it one at a time.
And then carotid. Alright. 2+. And then, no, it's not. Just kidding. And then if you can, if you can lift up that breast, this side right here, perfect. Apical pulse, 2+. All right, and then I'm gonna go to brachial. All right, 2+. And then radial. 2+. 2+. And then popliteal. 2+. All right, dorsalis pedis. 2+. All right. And then posterior tibial, 2+. All right. I want to go back towards the musculoskeletal and do a reflex as well. So if you can just drop your arm for me, perfect. All right, 2+. Two plus. Two plus. All right. So reflexes are all 2+. All right. And let's continue on. Any problems with doing your activities of daily living, like eating, brushing your teeth?
No.
Okay, do you use anything to help you walk around?
No.
Okay, you can do all those things on your own?
Yes.
Okay, that's perfect. And you can go to the bathroom?
Yes.
On your own, okay. All right, so ADLs are all within normal, and then let's go ahead and, so we have neuromusculo, we did skin, all right, and we did the pulses, because I jumped. I did. All right, any heart problems?
No.
Okay, any family history of heart problems?
No.
Okay. No heart murmurs that
No.
anyone's telling you had one?
No.
Okay. So what I'm gonna do is I'm gonna listen to your heart, okay? I just want you to just be your normal self. Alrighty. Okay, so I'm gonna listen to your carotid here. Oh, I'm sorry, that is respiratory. Carotid, let's do that later. Okay, so what I'm gonna listen to is I'm gonna listen to S2 landmarks over here, and then S1 after. While I'm here, I'm gonna be listening to the aortic. All right, let's go ahead. All right, and then the pulmonic. No heart murmurs noted. Normal rhythm. And then, so
Herbs.
well, herbs, that's a landmark. Herbs point and then tricuspid. All right, and then if you can lift up a little bit, mitral. This is also S1. All right, no heart murmurs noted, no abnormal sounds. Okay, so got that part, and then you don't have any changes in temperature, no redness noted, no edema noted. For cardiovascular, this is respiratory.
Mhm.
Oh my gosh, I kept going back to respiratory. Okay, so the heart is done?
Yeah.
Okay. And then we're gonna start now with respiratory, but what I'm gonna do first, I'm gonna start from the back.
Okay.
Okay? So what I'm gonna touch you, and do you have any problems breathing?
No.
Any shortness of breath?
No.
Okay. Alright, so I'm gonna touch you, and what I want you to do is just like take a pretty deep breath in and out, okay? Go ahead. Good. Perfect. Alright. Excursion is normal. And then I want you to go ahead and say 99.
99.
Say 99.
99.
Say 99.
99.
All right, and tactile firmness is normal. Resonance noted. You have me say noted. All right, so now I'm gonna listen to your carotid, okay? And then I'm gonna listen down here and then surrounding, okay? So. All right, bronchular sounds are normal and no bruit found. Take a deep breath for me, please. All right, and bronchiovesicular is normal, no bruits. Go ahead and do the same thing here. All right, that's normal. Do you use an inhaler? Okay. All right. This is vesicular is normal. Alright. And then I'm gonna listen to the back, okay? Just keep breathing. Normal. What am I supposed to say here?
Resonance, no adventitious.
No adventitious sounds. That's what I forgot.
Breathing is unlabored. That's for inspection.
Huh?
Breathing is unlabored, but that's for inspection.
Breathing unlabored. Oh, girl. Alright. Everything's great there. Okay. Next thing I'm gonna do is I did cardiac, I did respiratory. So where I'm gonna go is towards your abdomen. Do you have any problems going to the bathroom?
You mean palpate. I mean percuss.
Oh, sorry. I didn't progress. You're right. 'Cause I forgot to do.
Resonance noted.
Oh, okay. Oh, okay. Resonance is for percussion. Okay. Now let's go to your abdomen. Okay, so do you have any problems with going to the bathroom or going to like do number 2, bowel movements? Okay. Do you go like daily?
Yes.
And then, do you have any family history of any colon cancer or anything like that?
No.
Okay. And then, let's start with, let's go ahead and have you lay down. So what I'm gonna do first is I'm inspecting, she is not rounded, she is flat, skin. Alright, and then, what I'm gonna do is, I'm gonna touch you, is that okay?
Yes.
Everything, the skin looks normal to ethnicity. Everything's great here, and then what I'm gonna do is I'm gonna, I'm gonna listen, sorry. I'm gonna listen, then I'm gonna, percuss, and then I'm gonna palpate, okay? So we're gonna start off with the vowel sounds, and what I'm gonna do is I'm gonna, each section I'm gonna be on 5 seconds. So we're gonna start with the lower quadrant, okay? Lower right quadrant, right lower quadrant. Alright, no more active vowel sounds. 5 seconds, no more active vowel sounds. Alright. No more active vowel sounds. And I was just at the right upper quadrant, now I'm going to the left upper quadrant. And then now I'm going to the left lower quadrant. No more active vowel sounds. What am I assessing for here? The heart. I can hear the apical.
You can say it if you want, yeah, you can hear
Right.
it.
Okay.
You don't assess for it.
Alright, good. You stay hydrated. Alright, so now what I'm gonna do is I'm going to percuss, okay? Let me know if you feel any pain while I do anything, okay? Timpani noted on the right lower quadrant and right upper quadrant. Symphony noted on the left upper quadrant. Symphony noted on the left lower quadrant. Dullness on where the liver would be, so no hyper, not an enlarged liver. Alright, next thing I'm gonna do is I'm gonna touch you, okay, so this is gonna push on you a little bit, so I'm so sorry. Okay, let me know if it hurts. Alright, this is to locate the organs and to feel for any lumps or bumps, none noted, no masses. I just checked the right lower quadrant, checking the right upper quadrant, no mass noted, checking the left upper quadrant, no mass or nodules noted. Alright, and then lower left quadrant and no mass noted. Checking the bladder for any distension, no bladder distension. Alright, and then do you have any problems going to the bathroom, like to pee?
No.
Do you have any urgency, like to go pee a lot, frequently? Okay. Do you have any problems, family history of any urinal problems or kidney problems?
No.
Okay. If you can sit up real quick, because I do have one more thing. I have to check your kidneys and tell me if you feel any pain. Oh, gosh.
No. I didn't hear that.
I don't know if she did it, but yes. Something. I added it last minute and she was like, oh yeah, I forgot. Okay, so kidneys, no pain, so that means that you do not have a UTI. That's one of the testings that we can do, screenings for it. Usually if you have back pain in your kidneys area, then that usually can mean that you have some type of urinary thing going on. Okay, so let's start with now to reproductive part. So you have breasts and a uterus. So do you do breast self-exams?
Yes.
Okay, perfect. And you do it monthly?
Yes.
All right, and you get mammograms?
Yes.
Okay, perfect. And you see your OBGYN annually?
Yes.
All right, perfect. So the breast and genital urinary exam is deferred. So do you get your periods?
Yes.
Monthly?
Yes.
Have they changed?
No.
Okay, perfect. And then your sexual history I'd go over your pregnancy history, your social history, and then that completes the whole genital reproductive questions and exams. And then just to kind of finish off with the social history, do you smoke?
No.
Okay, do you use drugs?
No. Any
alcohol use?
No.
All right, perfect. And any family medical history that we should be aware of?
No.
All right. And then, so do you wear sunscreen when you go outside?
No, not regularly.
Okay,
Yes.
so definitely recommend it, no matter if you feel like you're gonna be in shade most of the time. If you're outside, the rays are very strong. It goes through like clothing, unless you have like sunproof clothing. But definitely recommend if you're going outside on a sunny day, just wear it. Make sure you cover all skin areas. Even your children, if you have children, make sure they have sunscreen on. Okay, preferably like 30, 40, 50. But 30 should be good. Okay. All right. Well, SPF 30. All right. So what I'm gonna do now is I'm gonna let the provider know about your exam findings, and what I want you to do is, if you need anything, let me know. Call me on the call bell that I'm giving you. I'll have your things in reach. But yeah, I'll be back whenever the physician and I go over the exams. Okay.
Okay.
I'm gonna wash my hands. And then I'm gonna provide privacy. Do you need anything before I leave?
No.
Okay. And then shut the door. All right. Thank you.